Hi, I'm Ellen Yankellow. I'm the president and CEO and founder of CorrectRx Pharmacy Services. Americans love a good story, and CorrectRx is one of those stories. In 2005, we were the successful awardee for the Department of Public Safety and Corrections for the provision of pharmacy services to that department, for that agency. The importance of that is it can't be overstated, because doing business with the state of Maryland and being the statewide provider for this the Department of Public Safety catapulted CorrectRx into the national scene. We had instant credibility as a result of the fact that we had a whole statewide system as one of our clients. And working along with the state of Maryland, they were very receptive to our concept of showcasing the clinical initiatives that we knew could make a dramatic difference in their overall quality of patient care, the outcomes of the patient, and also in controlling their drug costs by the kinds of drugs that are being selected and the quantity of drugs that are being dispensed. So right now we have 4 full-time clinical pharmacists that work in the correctional facilities, in the chronic care clinics, seeing patients and managing very high-cost disease states, very much like you would see at whether it's Kaiser Permanente or any other managed care arrangement, where you would really work the health pharmacist as part of the healthcare team and manages through medication therapy management, drug selection, collaboration with the practitioner to help control patients who have diseases, chronic diseases or acute diseases, and in the long run end up being very, very important to those patients when they come back into the community, and being able to actually save the state of Maryland, because the community that these patients live in are in the state of Maryland, and they come back in and there'll be less of a cost burden, because now they know how to be compliant with their medications, to make sure that they have their diabetes under control, that they take their medications for hypertension, and that the result is that you have a healthier population that costs less money overall. The overall healthcare costs are reduced as a result of these clinical initiatives. And what's been exciting about this, we've been able to call this the Maryland model. And this Maryland model now has been accepted by other states that we're currently working with and other clients. And so we just recently were awarded the state of Delaware contract. And in the state of Delaware now, they have asked us to include a full-time clinical PharmD as part of their request for proposal. And so what we're seeing is that there's this traction where they're realizing that for every dollar they spend on a clinical pharmacist, there's about a $7 saving in overall healthcare costs. And so we're collecting good data that is demonstrating over and over again the value of these clinical initiatives. And that probably is the key differentiator of CorrectRx, who is probably the smallest of the companies competing in this marketplace, compared to our competitors. This key differentiator are really believing in the value of clinical pharmacy. I guess as a pharmacist and as a pharmacy owned and operated company, I have a vested interest in believing that we can really make a difference as part of the healthcare